Hi, my name is Katie, and I did my needs assessment on the issue of homelessness in the trans adult community in Phoenix. So during this presentation, I'll be introducing the current statistics and issues of homelessness in the trans community. I'll share my data collection process, key findings resulting from the interviews, then I'll go over recommendations to address these issues, how I'll disseminate this information, and my personal reflection. So the target population is transgender adults in Phoenix, Arizona. The primary issue that will be addressed is homelessness for the trans community, and the purpose is to identify if there are already resources in place, what those resources are, and to identify needed resources to address these issues. Trans individuals often experience homelessness due to family rejection, housing discrimination, and job discrimination, which can lead to an increased risk for homelessness, as is noted in national and state level surveys. Um, 1 in 5 people identifying as transgender will experience homelessness at some point in their lives. And once a trans person experiences homelessness, they become vulnerable to discrimination and increased risks such as substance abuse and violence. There's 18 states in the US that include additional policies addressing the rights of those who identify as transgender when it comes to housing access and shelter. But in Arizona, there are no such laws or policies in effect. So I collected my data by first researching agencies that would have a close tie to my target population and primary issue. There were no agencies that directly address homelessness in the trans adult population, but there were a few agencies that have experience with homeless trans youth and navigating housing resources for trans individuals. So I ensured that the people I interviewed worked closely with the trans community and are invested in their needs and well-being, and that they serve the Phoenix area. I reached out by phone first and then email. I kept in touch with them over the process. The 3 agencies I was able to coordinate schedules with and do an interview were Trans Spectrum of Arizona, where I spoke to the president of the program, Kendra, Southwest Center for HIV/AIDS, which has a trans program headed by Ian Cashman, and 1 in 10, which is an LGBTQ youth program that has a housing program for at-risk youth headed by Sarah Kent. I asked each informant several questions aimed at getting to the core of this issue. One of the critical questions I asked is, what are the challenges experienced by the trans community? The overarching answer I got centered around the state of existing services for the homeless. Shelters and services in general are often inherently gendered because of our gendered society. Adding to that, social stigma around genders outside of the binary of male or female and stigma around those who don't identify as the sex they were born with lead to a lack of acceptance within these services. When I asked everyone why there's a lack of resources for homeless trans individuals, many of the same issues came up. There's a lack of knowledge of trans issues and experiences. The systems are binaried, and social policies lack funding that is necessary to make changes and provide training to staff to increase competence. When I asked what would be the most effective way to address homelessness in the trans community, several of them gave examples of ways to use a housing first model to address the critical component of homelessness. All informants pointed towards needing a shift in policy and society away from viewing it as an individual shortcoming to viewing it as a societal issue. So the most recurring theme is the lack of knowledge and confidence around trans and homeless issues. Increasing knowledge in critical organizations that address homelessness can help to bridge the gap. So reaching legislators and policymakers regarding these issues was mentioned to create more widespread awareness of these issues. The concept of housing first was a major recurring theme, so getting people housed regardless of identity leads to many other opportunities, such as getting a job and getting other necessary services. So getting people into housing was a very important thing that was coming up. Another recurring theme is that there's very few resources for trans individuals experiencing homelessness in Phoenix. So if you're above the age of 25, there are no trans-specific or trans-affirming housing options outside of places that have specific requirements like domestic violence shelters or substance abuse residential facilities. So if you're not having these issues, but you're a trans individual experiencing homelessness, there are no options available currently. So, based on the findings of my needs assessment, my first recommendation would be to make continuous competency training around trans issues mandatory in existing shelters and transitional housing programs. So, this can be achieved through legislative action and reaching out to policymakers while also making sure that the trans community is being consulted and is an active part of creating the training. Another recommendation is housing initiatives exclusively or primarily for trans persons. Two informants spoke about a specific concept of converting an abandoned mall into housing services for the trans community, much like it's being done for homeless communities in other cities. These can include additional services provided in the same facility, like as the housing, such as medical services and mental health services. Another recommendation is increased connectivity between social organizations and increased awareness of existing resources. So each person I talked to provided me with a new resource that the others had not heard of. So making sure that all these organizations that work directly with the trans community are aware of these places is essential to making sure that we're utilizing the resources that are already available. So I communicated with each informant about my wish to disseminate the results of this needs assessment with them. I offered to share any resources I gathered during the process and to share my qualitative data and key findings along with recommendations via email. In the email, I offered a follow-up meeting to discuss any initiatives that can be developed or assisted that align with the findings and recommendations of the needs assessment. So, as I conducted this needs assessment, I realized many of my informants thought a focus should be on improving existing systems rather than creating whole new systems. So, improving on policies and existing homeless resources to be more accommodating and accepting of trans individuals was most important, and being able to integrate trans individuals with the rest of society is ideal. I also found that the trans community is characterized by strength and resilience and inner community support and acceptance. However, that doesn't extend to the rest of society. So that support is severely lacking in the rest of society and in major organizations that provide services to them, which creates a huge barrier to societal integration. I had a difficult time even finding agencies that work directly with the community, and even more difficulty coordinating schedules because their workload is quite significant due to this lack of programs. I experienced some resistance at first because of a fear of being misrepresented. So they've had negative experiences with media and other outside entities attempting to get information, which has created a need for these programs to be careful and hesitant in who they talk to. This is also fueled by social stigma, which can create even more of a barrier when attempting to spread awareness and knowledge of trans issues.